animal. And I work in the pharmacology group. I work on the in vitro side. I do lab work. In the pharmacology group, we basically look at compounds that go from lead optimization, and we go through different types of assays to help them push them towards development. Sure. I got my bachelor's at SUNY Stony Brook, and my master's at New York University. Well, I always wanted to go into either the health sciences or do research. I had majored in biology and had been exposed to some health professions already. My mother was a nurse, and so that influenced me to go towards health. But I didn't really want to do medical school or optometry school, those kind of options that I had thought about. Mainly from college experiences in the laboratory, and I really was a lab rat. I really enjoyed working at the bench, doing experiments, and kind of just asking questions and figuring out things that nobody had ever really answered. And so going into the biotech field really wasn't something I had planned. I thought just academics was the way to go. I didn't really wasn't a field that I thought would be something I would be in. And it just kind of falls into your lap in the sense that you go through, you meet different people and they tell you what's out there through either industry or in academics, and you realize what the opportunities are besides academics. So that's kind of how I got in this particular field. I think if you're already in the biology field and you're exposed to doing lab work, either in college or in graduate school, you do get to see the options in academics. And a lot of people do go in academics. And I think also in the biotech industry, there's a big draw there as well. And I would say both paths are pretty typical, to go either into industry or to stay in the academic field. I would say that a lot of people who have experience already bring that with them, and they come expecting maybe something similar to what they've already experienced from a previous job or school, or something even more. And I think coming here, one of the biggest things was in a smaller biotech company, you do have that family culture, which you are able to really mingle with a lot of people that are both chemists and biologists, as well as clinical. As we've grown, we've been able to do that as well. And I think